Hello, welcome to daily Insta Live series of Health Hacks 109, where I talk about different health tips on the different health topics to have a super healthy lifestyle. Whoever joined, just say hi. Today is an exclusive session for ladies suffering from polycystic ovary disease, who are suffering from PCOD, that is polycystic ovarian disease, or PCOS, polycystic ovarian syndrome. So it is exclusively for ladies. But if you have anybody in your house, in your circle, who is suffering from polycystic ovarian disease, PCOD, which is very common, 1 in 10, in 10 women, 1 lady is suffering from PCOD, starting from the age 14 to 15. It is seen in early teenage also, and it is seen in later stages also. For new people who have joined me, my name is Dr. M.K. Shivani. I'm a medical professional, serial entrepreneur, and a wellness coach. I'm having daily Insta Live series on Health Hacks 109 to have a super healthy lifestyle. My mission is to help people to have a healthier, happier, and a prosperous lifestyle. So today I'm going to talk about PCOD. As I told, it is very common. So I'm going to see everything. There are 4 pillars of any wellness. If you follow these 4 basic pillars, you will not have those lifestyle disorders. When you come across any issue, it is only because you have neglected one of the pillar. The first is starts with exercise, routine exercises. A is attitude, having a positive attitude. And when you incur with lot of stress, lot of emotional challenges, you come across these lifestyle disorders to some extent. R is rest, like if you are not having proper rest, and most common reason is nutrition. So these are the 4 pillars of wellness. Whenever I talk about any issue, we covered about in pregnancy, we have covered about liver, heart, kidney diseases. We covered also about the thyroid. In every way, it is somewhat common, but particular one issue is covered with one specific tip already. So this is no PCOS. I'm covering today no PCOS. So N stands for no dairy product. If you are suffering from polycystic PCOD, no dairy products. And it is seen that ladies have more of a cravings towards dairy products. So milk, butter, the high fat milk, or processed food, sugary sweets, milk sweets and all that. So no dairy product is must for PCOD patient. O is obliterate the processed food. So always in teenagers, there is a tendency to go outside and have a processed food. So avoid this high processed, high carbohydrate processed food like burgers. Then P stands for protein. PCOD patient has to take protein, but which is of lean. If you are taking milk, then you have to go for a skim milk and not the high fat milk. C stands for carbohydrate, but carbohydrates, low carbohydrates and with low glycemic index. So typically you should avoid wheat. You should go for a barley, quinoa and oats. Having morning breakfast with oat or quinoa with fruits, it's very good breakfast for PCOD. Having frequent meals is also seen giving good results. Water retention is very much problem in PCOD patients. So you have to hydrate with water, and specifically the purified water, and if you can go for alkaline water purifier, or which contains the micro clustered oxidized antioxidant water, that is very good for PCOD. And O is opt for whole foods. You go for whole foods, fruits, vegetables, and complex carbohydrates and low fat food. So always it is seen that in PCOD patient there is a tendency 90% patient gain the weight. There are a few cases with the PCOD are with okay weight. So you have to maintain the optimum weight. So food choices makes a lot of difference in controlling the PCOD, which is very difficult. Having frequent meals with lot of water, fruits, vegetable, preferring natural foods, no MRP. No MRP is no malnutrition, R stands refined food, no refined food. P stands for processed food, no processed food. Avoid sugar, honey, like these things, and these patients are insulin resistant and water retention is the problem. S stands for supplements, so you should go for superfoods. Flaxseed and cinnamon, the boiled water with the flaxseed and cinnamon is very good. And for PCOD patients, having wrong choices brings the weight in PCOD patients. So take healthy snacks as usual, eat frequent meals, and supplement with the right supplements. For PCOD patient, right supplements are having all plant protein powder which contains low sugar and low carbohydrate. Unlike the traditional chemical protein powders available in the market are with high carbohydrate, with high sugar. So I prefer Nutrilite's all plant protein powder. In PCOD patients, good fat is required, and patients take the high processed and high fat foods because of the cravings. So omega-3 is a must for PCOD patients because good fat is required. So again, I recommend salmon omega-3 by Nutrilite. So if you go with these supplements which is lacking in your diet, with having good choices, your PCOD will be under control. I always say I got a 4-step formula. First is the awareness of your problem is important. What is going wrong? If you identify what is going wrong, what to do, what not to do, you will make those healthy choices on an everyday basis and install those habits. Once you bring those daily habits and install those good habits to change your lifestyle, to bring a good change in your life, you will get a greater results. Once you get a greater results, you will continue the habits. But to continue these habits, you require one accountability partner at home. It can be your friend, can be relative, your parent, your spouse, anyone, or anyone not at home, but you have to report somebody that I have taken a decision that to change these habits, and please help me in continuing those habits. If you do it for 21 days, you will get results. But any habit to install in your software, it takes 66 days. Follow any food choices, anything for 66 days, it will become part of your life. And I'm not going to talk much about how to maintain weight in this, because I'm going to come up with series about how you increase fat in your body and how to control your belly fat, the misconceptions and misbeliefs of decreasing your weight or shedding of your weight. So for PCOD patient, no PCOS, that is no dairy, obliterate processed foods, protein lean, carbohydrate with low glycemic index, opt for whole foods, and supplementation with right attitude to change your life. So stay tuned for my tomorrow's Insta Live. Thank you for joining. If you want to know about any particular topic, particular issue, get connected with me. We come up with a very personalized and a customized plan for any issue. I'm a nutrigenomics consultant, and your genetic tendency, your culture at home, your food culture brings lot of difference. So we can make a customized plan as per your requirement, as per your culture, and which will suit your genes. That is called nutrigenomics. You are what you eat. So you eat healthy to have a healthy and super healthy lifestyle. Signing off for the day, Dr. M.K. Shivani. See you tomorrow.